You've been in several different major positions in the healthcare industry. Talk to us about the intersection of race and health disparities.
One of the at least potential benefits of this bright light that COVID is shedding on our society. And we begin now to expose the hidden underbelly of the reality of America and the reality of African Americans living and trying to survive in America. We know, as I mentioned earlier, that the reason we are so susceptible to this virus is in large measure because of the living conditions. We are crowded together. When the advice by the public health experts are to isolate in place and quarantine, well, families are living multiple families in one small apartment with one bathroom. That's very, very difficult to do. We understand our tenuous relationship with employment, and we're the ones that are getting up and going out and catching the buses or driving the buses. We're the ones that are delivering the mail. We're the ones that are exposed. And so we now need to understand the meaning of systemic racism beyond rhetoric. But what we have got to be doing now, if we care about solutions, is to be precise about what it means to have structural relationships. We have to be very, very attentive to the way in which our communities are encouraged or disincentivized for businesses to locate, particularly food and grocery stores, so that we can have access to fresh fruits and vegetables, which are necessary for us to be maximally healthy. So what I would get to, Reverend Chavis, is that we just need to be clear that structural racism is a major problem, but that does not take us to solutions. Just recognizing it is important, but now we have to drill underneath that and begin to better understand how the fundamentals of health, which have to do with nutrition, food, has to do with housing, has to do with access to recreation, walking paths on our streets, safe streets, transportation. We need to look at all of those things and how they function, how they are made available or how they are not made available, so that we can then act on our own natural instincts, which is to try to do the right things and be healthy and follow guidance. We need to make sure that people can actually do the things that health experts tell us we need to do.